Dr. Leah, a young person asks, does piercing my genitals increase my risk for infection?
Anytime you create an opening in the body, there is a chance of infection. So especially going to an iffy piercing shop can put you at risk for Hep B, Hep C, HIV, tetanus, etc. All these piercings can lead to bleeding and scarring, wherever it is. So you want a piercer that's a member of the Association of Professional Piercers, APP. You want to make sure that the person who's doing the piercing checks your ID, cleans the genital area thoroughly with an antiseptic, wears gloves, and uses a sterilized needle. Very important. After you get pierced, make sure to follow all of the instructions for keeping the area clean. Wash with soap and water or saline solution. Do not use alcohol or peroxide. I very embarrassingly enough used peroxide after I skinned my knee. Used way too much. The tissue never healed, and I'm convinced that's the reason for a beautiful scar that I have. So keep in mind, peroxide may harm the tissue and delay the healing. Don't have sex for at least 2 weeks after getting pierced. You want to make sure that area is properly healed. Open areas, keep in mind, are also much more likely to contract an STI. So once you do have sex, clean the area afterward, and it's always good to factor in the fact that that jewelry and from the piercing could potentially poke a hole in a condom.
Dr. Leah, a man writes, whenever I drink, I can't get it up. What should I do?
Well, stop drinking, or at least so much. There's actually a term for this. It's called whiskey D. But it's not just whiskey that can affect it. Drinking large amounts of alcohol can make it hard to get or keep an erection. And this happens for many different reasons. Alcohol can reduce the production of testosterone, which is needed for arousal, orgasm, etc. And this could happen short term, or like an acute consumption. This could also happen chronically over time. So the more alcohol you're drinking, the more testosterone you're going through. Alcohol also increases angiotensin, and this is a hormone that causes the blood vessels to become constricted and much more narrower. So naturally, that's going to lead to erectile dysfunction as well. Alcohol is also a central nervous system depressant. When you drink, it has a slowing effect on your brain, and it also affects many significant other organs, including the penis. So it messes with your ability to feel sexual stimulation, and the penis is essentially not getting the message that it needs to fill with blood. Also, alcohol in general slows your reaction time. It makes it difficult for you to focus and concentrate. It impairs your coordination. So it's probably not going to help your sexual performance either. Just so you know, women also go through this. It's called whiskey C, or whiskey vagina. Alcohol acts as a diuretic for both sexes, but for women, it interferes with the production of lubrication, and alcohol can affect orgasms, causing them to be less intense and making it even harder to achieve. So drink a little less, your sex life might depend on it. What's our next question?
Dr. Leah, a pregnant woman asks, will childbirth stretch out my vagina? Will it be noticeably bigger after I have a baby?
Your vagina stretches up to 3 times the normal amount during birth in order to let the baby pass through the birth canal. But the vagina is designed to stretch and accommodate a baby. After a delivery, the tissue will usually shrink back down to its pre-pregnancy state. Keep in mind, there are exceptions. Having a baby with a really big head, or several vaginal deliveries might make it less likely to go back to 100%. So your vagina might be slightly wider than it was in the past, but this doesn't necessarily mean it'll happen. I've had friends say that they didn't notice at all, and I've had friends say that they did notice. I was actually out to dinner with a couple that recently had a baby, and when he went to the bathroom, I asked her, like, can you tell a difference during sex? She's like, no, I can't tell a difference. It's great. Ask him. I did not ask. That would have made the rest of dinner really awkward, but just keep in mind, it really depends on the couple. Also, you may perceive weaker vaginal muscles post-childbirth as somehow a looser vagina, in which case Kegel exercises can help. In order to do Kegels, you squeeze the muscles that stop the urination, and you hold that start for about 5 seconds, and then release, and then again for 5 seconds. Just progressively work your way up to a longer time. If that doesn't work, there's actually pelvic floor physical therapists that can help you.
Researchers at Wilkes University in Pennsylvania found students who had sex once or twice a week had higher levels of antibodies that fight disease in the lungs, stomach, and intestines. And these antibodies can potentially ward off colds and boost overall immunity. Plus, frequent sex is good for your heart rate, blood pressure, and circulation. Orgasms release endorphins and serotonin, which can relieve pain. They can also improve sleep, and a restful night gives your immune system a real boost. Another study found that sexual activity can provide relief from migraines and cluster headaches. Researchers say it's not just the full sexual act that's good for your mental and physical health. A cuddle or makeout session has its health perks as well. Affectionate partners report lower stress and less anxiety, according to the Kinsey Institute. And kissing can reduce the immune system's inflammatory responses as well.